How are early Parkinson's symptoms diagnosed when subjective? Imagine trying to catch a faint whisper before it turns into a loud noise. That's similar to diagnosing early Parkinson's disease when symptoms are subtle and subjective. Early signs can be tricky because they often overlap with normal aging or other health issues. There is no single test that can definitively diagnose Parkinson's at this stage. Instead, doctors relying on careful clinical evaluation, especially from specialists trained in movement disorders. The first step is recognizing early symptoms. Some non-motor signs like a reduced sense of smell, constipation, sleep disturbances such as REM sleep behavior disorder, or mood changes like depression can appear years before any movement problems. These signs are important clues but are not exclusive to Parkinson's. Motor symptoms, which are more specific, include slowness of movement known as bradykinesia, a resting tremor that occurs when muscles are relaxed, and muscle stiffness or rigidity. These motor signs may be mild or only affect one side of the body in early stages. To make a diagnosis, clinicians use established criteria that focus on the presence of bradykinesia plus at least one other motor feature like tremor or rigidity. During a neurological exam, a specialist looks for these signs, paying attention to how symptoms present and whether they are asymmetric. Because early symptoms can be so subtle, the expertise of a neurologist or movement disorder specialist is crucial. They may observe how symptoms change over time and how they respond to medications that increase dopamine levels, which often improve motor symptoms in Parkinson's disease. Gathering a detailed patient history is also vital. Doctors ask about when symptoms started, how they have progressed, and whether there are associated non-motor signs. Tracking these changes over multiple visits helps differentiate Parkinson's from other conditions with similar features. Sometimes, imaging tests like dopamine transporter scans are used to support the diagnosis. These scans can show reduced dopamine activity in the brain, which is characteristic of Parkinson's. However, they are not routine and are mainly used when the diagnosis is uncertain. One of the biggest challenges is that early non-motor symptoms are nonspecific and can be caused by many other health issues. Because of this, diagnosis based solely on subjective symptoms is difficult. The key is to look for motor signs that are more objective and to combine this with a thorough clinical assessment. Often, diagnosis is not made immediately but is confirmed over time as symptoms evolve and respond to treatment. In conclusion, diagnosing early Parkinson's when symptoms are subjective involves a careful balance of clinical observation, detailed patient history, and sometimes supportive imaging. The process requires patience and expertise, as early signs can be subtle and easily mistaken for other health issues. If you or someone you know is experiencing these symptoms, consulting a healthcare professional with experience in movement disorders is essential. They can provide a comprehensive assessment and help determine the best course of action.